Hello and welcome to Med4Care. I am Dr. Care and today's topic is the recommended diet in case of gastritis. Gastritis, which can be acute or chronic, is an inflammation of the gastric mucosa. It is part of a large group of diseases, called gastropathies, and can have multiple causes, from Helicobacter pylori infection to particularly intense stress. In any case, nutrition can be one of our best allies. Indeed, an appropriate diet can positively influence the course of the disease and soothe the symptoms. Choosing the right foods helps not to further compromise the stomach walls and limits the risk of further acidity and irritation. At the same time, it can represent an effective prevention strategy. In general, the golden rule is to prefer foods with low acidity, low in fat, prepared with short and light cooking. It is also recommended to reduce or even better to eliminate the consumption of refined sugar and margarine, the latter to be replaced with olive oil, preferably extra virgin. In particular, among the foods recommended in case of gastritis we find all leafy vegetables, rich in fiber, such as spinach, salad, chard, but also fennel, zucchini, artichokes, green beans, celery and carrots, apples and berries, bananas, figs and all non-acidic fruits, and again, legumes, such as beans and lentils, pasta and rice, preferably wholemeal, cereals, potatoes, eggs, jams, biscuits, rusks, crackers, low-fat cheeses, and semi-skimmed milk. On the contrary, the foods to be avoided to prevent the worsening of the inflammation of the gastric mucosa include all foods with a high fat content, such as some cheeses, sausages, butter and margarine, fried foods, spices, in particular pepper and chili, except for ginger, tomatoes, peppers, mandarins and sour fruit, elaborate sweets, coffee, tea, alcohol and sugary drinks. There are also some recommendations that are particularly useful for those suffering from gastritis, but which in truth we would all do well to follow. Try to avoid prolonged and elaborate cooking, fried foods, sauces, condiments that are too fatty. Eat light and frequent meals and try not to skip breakfast. Let's chew slowly and consume the meal calmly and without distractions. To avoid the risk of gastric reflux, don't lie down immediately after eating. Do not smoke and consume alcohol and always keep yourself well hydrated, drinking water or herbal teas, preferably away from meals. In particular, the consumption of herbal teas based on lemon balm, mallow and chamomile helps to keep anxiety and stress at bay and to avoid the risk of nervous gastritis, thanks to their emollient and anti-inflammatory action. Aloe vera in juice is also a very effective gastroprotector and is strongly recommended, being able to create a sort of protective film on the internal mucous membranes of the stomach. Following a healthy diet has many benefits, which are not limited only to the well-being of the stomach but involve the entire body. For this reason, let's try to make conscious and balanced food choices and never forget that good health begins at the table. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med4Care.